I think psychiatry is the easiest medical specialty to be bad at. But I also think it's one of the hardest medical specialties to be good at. And it's both for the same reason, because there is very limited empirical objective data. But there is a surplus of qualitative objective data. Empirical objective data is something like a blood pressure cuff, which gives you 120 millimeters of mercury. Qualitative objective data is something like the physical exam. How swollen my legs look is an objective thing, but how I interpret it, that's subjective. MRIs may empirically interpret a scan, but is subjectively interpreted by the radiologist, which is valuable, but the machine's valuable too. Every step of this process is valuable. But with psychiatry, you are the CT scanner, you are the lab values, you are the physical exam, you're all of those things at once. So when I go to see patients, I try to see myself like I'm an instrument to detect disease. I have my own sensitivity and specificity for every mental illness. Depression, I might be 100% sensitive for, 60% specific. I don't know, personality disorder, I might be only 50% sensitive for because it's a lot harder to detect that. But every individual psychiatrist has their own false positive and false negative rates. That's a fact. So here's why it's easy to be bad in psychiatry. The only documentation of all of your false negatives as a psychiatrist are based in your word. If you just say, I assess this patient, I don't think they're X, there's nothing else that can go against you besides another psychiatrist that assessed someone and then disagreed with you. There's no lab, biopsy, or imaging that can come out and prove that you missed a really important diagnosis. It's a game where you have to call spades spades, but someone could be calling clubs spades for 2 decades and never know. Borderline bipolar. And unfortunately, that means a lot of bad medicine can hide in psychiatry, and a lot of bad doctors can hide in psychiatry. I have a moral responsibility to be as good of an instrument to detect mental illness as I can. I need to research. I need to be self-critical. I need to be as empathetic as possible to increase my sensitivity and specificity for every single disease that I can to the best of my ability. And I think that's the most beautiful thing about psychiatry. That skill, that personal nuance, your ability to get information out of people, to use your rapport with someone, your ability to get along with someone, to get to the core of a diagnosis, that's so unique. There's no guideline that you can follow, but your skill really matters. I used to joke that you have enough bananas, you could teach a monkey to replete sodium. And a lot of things have very particular algorithms that you follow for a reason. And the fact that psychiatry doesn't have those things makes it an evil place where bad medicine can hide and a beautiful specialty where really talented people can flourish. And I hope one day to be one of those talented people.